Diverticulitis is an gastrointestinal disease. Look at this picture, shows that large intestine. Diverticular. CT findings, MRI findings, and ultrasound and X-ray findings. Look at this detail going on. Introduction. Diverticulitis is a common gastrointestinal condition that involves the inflammation or infection of small pouches called diverticula that can form along the walls of the digestive tract, particularly in the colon. These pouches are generally harmless but can lead to serious complications when inflamed. Definition. Diverticulitis is the inflammation or infection of one or more diverticula. These diverticula are small bulging pouches that can form in the lining of the digestive system, most commonly in the lower part of large intestine, colon. Types. 1. Uncomplicated diverticulitis involves mild inflammation or infection without severe symptoms or complications. 2. Complicated diverticulitis. This type involves more severe conditions such as abscess, perforations, pustulas, blockages, etc. Causes. The exact cause of diverticulitis is not completely understood, but it is believed to involve several factors. 1. Increased pressure in the colon. This can lead to formation of diverticula and subsequently cause inflammation. 3. Infection. When fecal matter or undigested food gets trapped in the diverticula, it can lead to infection. 3. Diet. A diet low in fiber, high in processed foods may contribute to the development of diverticula. Risk factors. 1. Age. People over 40 are more likely to develop diverticulitis. 2. Diet. Low fiber intake and a high fat diet increase the risk. 3. Obesity. Being overweight is a significant risk factor. 4. Lack of physical activity. A sedentary life contributes to the development of diverticulitis. 5. Smoking increases the risk of complications from diverticulitis. 6. Medications. Use of non-steroidal anti-inflammatory drugs, NSAIDs, steroids and opioids, and increase the risk. Complications. 1. abscess, pockets of infections that can form around the inflamed diverticula. 2. Performation, a tear in the intestinal wall leading to the leakage of intestinal contents into the abdominal cavity. 3. Peritonitis, inflammation of the abdominal lining due to infection. 4. Fistulas, abdominal connections between different organs or tissues. 5. Intestinal obstruction, blockage of the colon due to scarring or swelling. Pathophysiology. The development of diverticula begins with the formation of small pouches due to increased pressure within the colon, often at weak point in the intestinal wall. When these pouches become inflamed or infected, diverticulitis occurs. The inflammation can lead to localized pain, swelling, and sometimes systemic symptoms like fever. In severe cases, the inflamed diverticula can rupture, leading to peritonitis, abscess formation, or sepsis. Step-by-step process of pathophysiology. 1. Formation of diverticula, weak points in the colon wall, increase the intraluminal pressure. 2. Diverticulosis development, asymptomatic diverticula, accumulation of facial matter. 3. Micro performation, local trauma and irritation, bacterial proliferation. 4. Acute inflammation, inflammatory response, edema, blockage. 5. Complications, abscess formation, perforation, fistula formation, structure and obstruction. 6. Systemic effects, fever, leukocytosis, sepsis. Signs and symptoms. 1. Abdominal pain, often severe and typically located in lower left quadrant. 2. Fever, chills indicating the infection. 3. Nausea and vomiting due to intestinal discomfort and inflammation. 4. Change in bowel habits. This can include diarrhea and constipation. 5. Bloating and flatulence, common symptoms due to inflammation. 6. Tenderness in the abdomen, particularly when processed on the affected area. Diagnosis. 1. Physical examination identifying tenderness and signs of infection. 2. Blood test checking for signs of infection such as elevated white blood cell count. 3. CT scan, the most effective image test to confirm the diagnosis and assess complications. 4. Ultrasound, sometimes used to identify inflammation or abscess. 5. Colonoscopy, typically done after recovery to assess the extent of diverticulitis. Nursing diagnosis. 1. Acute pain related to inflammation of the diverticula. 2. Risk for infection due to the presence of inflamed or ruptured diverticula. 3. Imbalanced nutrition less than body requirements related to nausea and vomiting. 4. Deficient knowledge related to disease process management and prevention. 5. Risk for fluid volume deficit related to vomiting and decreased intake. Management. 1. Pain management, use of analgesics and antispasmodics to control pain. 2. Fluid and electrolyte management, IV fluid to prevent dehydration. 3. Antibiotic therapy to treat bacterial infection in complicated cases. 3. Nutritional support, initially a clear liquid diet followed by a gradual return to high fiber diet. 4. Monitoring and observation, regular monitoring of vital signs, abdominal assessment and lab results. Treatment. 1. Mild cusses, managed with rest, oral antibiotics and temporary liquid diet. 2. Severe cases may require hospitalization, IV antibiotics and possibly surgery. 3. Surgical intervention in case of perforation, abscess or recurrent diverticulitis. Resection of the affected bowel segment might be necessary. Psychosocial medicine. 1. Anxiety and stress management due to the chronic nature of the disease and fear of complications. 2. Patient education, importance of dietary changes, regular follow-ups and recognizing symptoms of complications. 3. Support systems, encouraging involvement in support groups or counseling for coping strategies. Prevention. 1. High fiber diet helps in preventing the formation of diverticula by promoting regular bowel movements. 2. Regular exercise, reducing the risk of diverticulitis by maintaining a healthy weight and encouraging bowel regularly. 3. Adequate hydration, important to prevent constipation. 4. Avoiding smoking and NSAIDs reduces the risk of developing complications. Conclusion: diverticulitis is a manageable but potentially serious condition that requires a comprehensive approach to treatment and prevention. Early diagnosis, effective management, and lifestyle changes are key to preventing complications and improving quality of life for individuals with this condition. Regular follow-ups and adherence to medical advice are crucial for long-term management and prevention. Thank you. Have a nice day.